Bismillahirrahmanirrahim. The quote for today is to keep the body in a good health is a duty. Otherwise, we shall not be able to keep our mind strong and clear. Today, we are going to discuss about the measures of morbidity. I am Dr. Awais and I am giving this presentation under the kind supervision of Professor Saira Afzal. The learning outlines for today's presentation will be introduction to the measures of morbidity like the incidence prevalence, comparison of incidence and prevalence, sources of morbidity data, recent updates, and at the end will be the MCQs. By the end of this presentation, participants will be able to describe the importance of incidence prevalence and its use in terms of prevention and control of diseases. Now, what is the morbidity? Morbidity is any departure, subjective or objective, from a state of physiological well-being. It is like sickness, illness, or disability. Morbidity is in turn measured in three terms, that is frequency of disease, that will be incidence or the prevalence, duration of illness, that may be calculated in days, months, or years, and the severity of illness, that may be indicated as case fatality rates and the other terms. No, while calculating the morbidity, we have certain problems with the numerators, denominators, and the overall equation. The most common problems with the numerator is that who has to be included in the numerator and who has the disease, while the problem with the denominator is that it there arises a problem selective underscoring, and everyone in the denominator must have the potential to enter in the numerator group. There is also a problem with the hospital data is that there is a selective for many reasons and data may not be available due to certain reasons. Now coming towards the incidence. Incidence is the number of new cases occurring in a defined population during a specified period of time. It may be defined as number of new cases of a specific disease during a given time period. It has two definitions, the incidence proportion and the incidence rate. Incidence proportion is the number of new cases of a disease divided by the population without disease at baseline into 100%. While the incidence rate, also known as the incidence density, is the number of new cases of a disease divided by the percent time at risk. So the difference between the proportion and the rate is that the denominator in proportion is not a part of numerator, while in rate, the denominator is a part of numerator. Now coming towards the example of the incidence, this vertical line indicates the date, that is 1/1/1990, and this line, second vertical line, indicates the date of 1/1/1991. So if we have to see the incidence of AIDS in 1990, then we have to see with the new cases which arise in 1990. So the case number three is the new case diagnosed of AIDS in 1990. Similarly, the case number four also the new case of AIDS. Similarly for the five and the seven, six, eight. While these are the old cases, so these will not be included in the incidence. So the new cases of AIDS will be the four out of total of six. So incidence rate is refers to only to the new cases, and it is only for during a given time period. And we have to include in the denominator population at risk. It is useful for the new spells or episodes of a disease in a given period of time per thousand population. Coming towards the cumulative incidence, it is the number of people who get a disease during a specified period divided by the number of people free of disease in population at risk at the beginning of the period in 2000. So the main difference here is for the cumulative is incidence is that it includes those people who are at risk at the beginning of the period. Cumulative incidence is simpler measure of occurrence of a disease or health status. Unlike incidence, it measures the denominator only at the beginning of the study. In a statistical sense, the cumulative incidence is the probability that individuals in the population get the disease during the specified period. The period can be of any length, but it is usually in several years or even the whole lifetime. The cumulative incidence rate, therefore, is similar to the risk of death concept used in life table calculation. The simplicity of cumulative incidence rates makes them useful when communicating health information to the general public. Now, the special incidence rates, like the attack rate, also known as the case rate, scanty attack rate, hospital admission rate. Attack rate is an incidence rate usually expressed as a percent, used only when the population is exposed to a risk for a limited period of time, such as during an epidemic. It reflects the extent of epidemic. Its equation is the number of new cases of a specified disease during a specified time interval divided by the total number of total population at risk during the same interval into 100. So in the denominator, we include only those population who has at risk of developing the disease. So the secondary attack rate. It is the number of exposed person developing disease within the range of incubation period, where the total number of exposed or the susceptible contacts into 100. The most important thing while calculating the secondary attack rate that we should have to remind is that the primary case is excluded from both the numerator and denominators. We do not include the primary cases while calculating the secondary attack rates. Its limitation is that it is useful only for diseases with short incubation period, and it's not possible to identify the susceptible cases in many scenarios. So, the candidate rate is the number of exposed person developing the disease within a range of incubation period following exposure to a primary case. Coming towards the example of a candidate rates, consider that in a family of 6 persons consisting of 2 parents that are immune to a certain disease and 4 children that are susceptible of developing the chickenpox. One children One child develops chickenpox, and after some time, 2 other children develop among three. So, how will calculate the secondary attack rate? There are 6 persons. The parents are immune, so we will exclude these 2 parents. One is the one child has already developed the disease. That is the primary case. We will also exclude it. So the secondary attack rate will be 2 divided by 3. 3 is the number who has the potential of developing the disease that has the chance of developing the disease, while the others who do not have the disease. So for this scenario, the secondary attack rate will be 66%. Coming towards the case fatality rate, when we are considering the total deaths in a specific population rather than the cases, then the indicator is known as the case fatality rate. For example, 20 died out of 1,000 of COVID-19. Its uses for the incidence rate is that it is useful for controlling disease, for research into etiology and pathogenesis, distribution of disease, efficiency of preventive and therapeutic measures. Now coming to what is the prevalence. Prevalence is all current cases that are old and new existing at a given time period or over a period in each population. We will define the prevalence as the total number of all individuals who have an attribute or disease at a particular time divided by the population at risk or having the attribute of disease no or midway through the period. It has two types, point prevalence and the period prevalence. Point prevalence is the number of all current cases, old plus new, at one point in a defined population, divided by estimated population at same point in time. While the period prevalence is number of existing cases, old plus new, during a given period of time interval, divided by estimated mid interval population at risk. So the basic difference between point prevalence and period prevalence is that uh, point prevalence in we determine the prevalence at only one single point of time, while in period prevalence we calculate the prevalence for a given period of time interval from this date to this date. Look at the example of a point prevalence. For example, we have to calculate the point prevalence of AIDS on the date of 1/1/1991. So we have to include only those cases who have all the new and old cases who are only present at the time of this date 1/1/1991. So there are total so there are total 4 cases. One and that is present on 1/1/1991. This is second. This is the third one, and this is the fourth, while the others are excluded. So for the period prevalence, we have to include all the cases from this date 1/1/1990 to 1/1/1991. So during this period, we have total cases of AIDS are 1, 2, 3, 4, 5, 6, and 7. 7 cases during this time period. The relationship between the prevalence and incidence is that prevalence equals to incidence into duration. If population is stable and the incidence and duration are unchanging, longer the duration, greater is the prevalence rate. For example, TB. Acute disease, short duration and rapid recovery, so prevalence is less than incidence. Factors influencing observed prevalence rate. These are longer duration of disease, prolongation of life without cure, increase in new cases, incidence average, out migration of non-disease people, in migration of susceptible disease people, improved diagnostic are reporting. The use of prevalence is that it has to estimate the magnitude of health problem disease in the community, identify potential high-risk population. It is also useful for administrative and planning purposes. Comparative factors affecting prevalence rates. Rates are increased by immigration of ill cases, immigration of healthy persons, immigration of susceptible cases are those with potential of becoming cases, prolongation of life cases without cure, increase of duration of disease, increase in occurrence of new cases, and increase in incidence. Now, the comparative factors affecting prevalence rate are these are decreased by immigration of healthy persons, immigration of ill cases, improved cure rate of cases, increased death rates from disease, decrease in occurrence of new cases, shorter duration of disease, and death. Now, the sources of morbidity statistics. These are gathered from clinical and hospital data, managed care registers, vital statistics surveys, disease reporting, insurance and prepaid medicine care plans, and absenteeism records. Its uses are it describes the disease load in community and assesses in establishment of priorities, provide more comprehensive, accurate, and clinical relevant data essential for basic research, monitoring and evaluation of disease control and prevention activities. Now, the characteristics of the prevalence incidence rate. The probability of disease in prevalence is the percent of population with the disease, while incidence rate it is the rapidity of disease occurrence. The units in prevalence, it has no unit, while in incidence rate is this cases per person time. In prevalence, there we include the newly diagnosed patients and the old cases, while incidence rate we include only the newly diagnosed cases. In incidence rate, we have the incidence density, while there is no such term for the prevalence. The difference between the incidence and prevalence is that in the numerator of the incidence, the number of new cases of a disease during a specified period of time, while in prevalence, there is number of existing cases of disease at a given point of time. Existing cases include all the new and old cases. The denominator incidence is population at risk, while it is same for the prevalence. An incidence focuses on whether the event is a new case or the time of onset of the disease, while the prevalence focuses on prevalence or absence of a disease time. Time period is arbitrary rather than a snapshot in time. Incidents are used in expressing the disease of becoming ill. The main measure of acute disease or conditions, but also used for chronic disease, more useful for studies of causation. While the prevalence is used for estimates the probability of the population being ill at period of time being studied, and it is also useful in study of the burden of chronic disease and implication for health services. In summary, it lists the basic measurements in epidemiology. Select an appropriate tool for measurement, measures morbidity and mortality, perform standardization of rates. Now coming towards the recent updates, uh, here is one article from that is published on 2020. The article's title is Epidemiology of Autism Spectrum Disorder, a review of worldwide prevalence estimates since 2014. So in this study, we will see that all the measures of morbidity are being used for different diseases reporting. The abstract of this study says that the prevalence of autism spectrum disorder has increased dramatically in recent decades, supporting the claim of an autism epidemic. Systematic monitoring of autism spectrum disorder allows estimating prevalence and identifying potential sources of variation over time and geographical regions. At present, autism spectrum disorder prevalence estimates are available worldwide, coming either from surveillance systems using existing health and education databases or from population studies specifically performed. In the present article, they present a review of autism spectrum disorder prevalence estimate published since 2014. Data come from a high variability in prevalence across the world, likely due to methodological differences in case detection and the consistent increase of prevalence estimate within each geographical area. The second article is retrospective analysis of OLRA. and acute watery diarrhea outbreaks in Ethiopia from 2001 to 2023. Incidence, case fatality rate, and seasonal and multi-year epidemic patterns. The Ethiopian government has developed the multi-sectoral cholera elimination plan with an aim of reducing cholera incidence and case fatality rate. To better understand and monitor the program of this plan, a comprehensive review of national cholera epidemiology is needed. Reported data on acute watery disease and cholera uh, cases in past 20 years were extracted from Ethiopian Public Health Institute and World Health Organization databases. Descriptive statistic pairs and price care and logistic regression analysis were conducted. The results say that from January 2001 to November 2023, a total of uh, 200,000, more than 200,000 cases of cholera and acute water diseases, and among them 2,355 deaths with a cumulative case fatality rate of 1.10 and a mean annual incidence rate of 8.9 per 100,000 were reported. Two major upsurges of cholera epidemics were found in the last 2 decades with a mean attack rate of 20.57 divided by 100,000 in 2006 to 2010 and 14.83 divided by 100,000 in 2016 to 2020. And the resurgence of outbreaks occurred in 2021 to 2023, whose mean attack rate is 8.63 divided by 100,000 in 2015 to 2023 and 54% of 54%. That is 53,990 over 99,945 cases were aged 15 to 44 years. National cholera case fatality rate was the highest in 2022. The 2015 to 2023 community cholera case fatality was different across regions. One region has the case fatality rate of 6.07%, one second region has 1.89%, and the third region has 1.42%. Now, coming towards the MCQs. First MCQ is a city has a population of 50,000 people. In 2023, there was 200 newly diagnosed cases of respiratory disease. Which measures would best reflect the frequency of new cases within the population, whether the point prevalence, period prevalence, incidence rate, case fatality rate, or the secondary attack rate? It's C, incidence rate. So they have to report the newly diagnosed cases. Second MCQ study starts with 4,875 healthy people. Data subtracted from the 5,000 people because 125 are the old cases. Over the next 2 years, 75 people develop the disease. What is the incidence rate of disease over the study people? So it needs a calculation. So the incidence rate will be calculated by the new cases divided by the population at risk by 2 years. So if we calculate it, it comes out to be 7.69%. So the correct option will be A, 7.6%. Coming toward the third MCQ, during an outbreak in a village, 30 residents developing systems within 10 days after a primary case was identified. There were 50 people in close contact with the primary case. What is the secondary attack rate of the disease in this scenario? Whether 20, 30, 50, 60, or 75%. So we will calculate the secondary attack rate by uh, putting all the new cases in numerator and the susceptible population at the denominator. So there are 30 new cases of a disease, and there are 49 people of 49 susceptible people who are have a potential of developing the disease because one among them is a primary case. So if we divide 30 by 50 into 100, the result will be 61%. So the correct option will be 60%. That is closest to 61. Fourth MCQ is many of the students at the boarding school, including six just coming down with the varicella, went home during the Thanksgiving break. About 2 weeks later, four siblings of these six students Out of total 10 siblings, 12 were illegal. The secondary attack rate among the siblings was whether 1.2 divided by 6, 4 by 6, 4 by 10, 4 by 16, or 6 by 10. So the correct option will be 4 divided by 6. Fifth MCQ, public health researcher wants to understand the burden of disease in a city, including both old and new cases over a one period. Which measures of morbidity should the researcher use?
C.
Yes,
Period prevalence.
it's C, period prevalence. So it has to report for a 1 year period. Sixth MCQ is in an outbreak of cholera in a village, 2000 population, 20 cases have occurred and 5 died. Case fatality rate is whether 1%, 0.25%, 5%, 25%, or 0.0025%. So it also needs only a minimal calculation. It's a simple scenario. We will put 5 for calculating the case fatality rate in numerator, and the denominator will be 20. So the answer will be 25%. D will be the correct option. Seventh MCQ is the results of the study of incidence of a pulmonary tuberculosis in a village in the country are given below. All persons in the village are examined during two surveys made 2 years apart, and the number of new cases was used to determine the incidence rate. Category of household at first survey number of persons are 500, and number of new cases with culture positive cases are 10. Without culture positive case, 10,000, and new cases are 10. What is the incidence of new cases in a household that had a culture positive case during the survey, whether 0.02, 0.01, 1.0, 10, or 20? So it also needs a simple calculation. We will put 10 in numerator and 500 in the denominator, as these are for the new cases with culture positive, and the correct answer will be 0.02. Eighth MCQ is in a population of 1,000, measles or coverage is 60%. One child goes out of station and comes back with measles from 20 more children get measles. Can the attack rate of measles is 0.6%, 5%, 6%, 6.7%, or 7%? It is B, 5%. It also needs some calculation. Here is the calculation. Coming towards the ninth MCQ, when total number of deaths due to measles is presented in relation to the total cases of measles, it is labeled as false specific death rate, incidence rate, prevalence rate, case fatality rate, or proportional mortality. It is case fatality rate, number of deaths due to a certain disease. 10th MCQ is in a region where a chronic illness has been prolonged due to improved medical care, what would be the expected trend in prevalence of the disease, assuming all else remains constant? Whether prevalence decreases due to better care, prevalence remains the same, prevalence increases due to prolonged life, incidence rate increase, or the incidence rate decreases. If all the other parameters remain constant, then the prevalence increases due to the prolonged life. Here is the key of the MCQs. Here is our YouTube channel from the Community Medicine Department of Kingdom Medical University, where all the presentations of the postgraduate residents are uploaded. Everyone can go through this channel and watch this video, watch the presentations. And thank you very much for today's presentation.
Thank you very much, Dr. West. Very nice presentation, and I hope everyone would do the exercises as you have presented today in order to know more about the incidence rate, attack rate, secondary attack rate, prevalence rate, point prevalence rate, period prevalence rates, as well as the different morbidity indicators, especially the cumulative incidence and incidence density. That needs a lot of practice, and I hope everyone will do it. So today, everyone should come to the skill lab. I'm here. All the postgraduate students should join us here. Thank you.
Welcome, ma'am.